Hi, my name is Yinyin, and I'm a PhD student with IMPACCT, and my PhD focuses on managing odour in chronic and malignant wounds. So that will be my focus of the talk today. So chronic wounds are those that fail to progress through the normal stages of healing. The most common types being diabetic foot ulcers, venous leg ulcers, pressure and arterial ulcers, and malignant wounds also fall under this category. The most common type of cancers being breast cancer and head and neck cancer. So there's a huge burden caused by chronic wounds in all aspects, financially, physically, emotionally, and socially. In an economic sense, in Australia, there are 450,000 people with chronic wounds, and this costs the health system $3 billion per year, with each patient spending over $4,000 on out-of-pocket expenses. With the aging population and most patients being over 65, that places an unbearable pressure on pensioners and retirees. Similar figures across the world show how common of an issue that these chronic wounds are. In the UK, it affects over 2.2 million people and costing 5.6 billion pounds per year. In America, it's 8.2 million people affected, and that costs them over $23 billion a year. These chronic wounds can take several years to heal, and some even remaining unhealed for decades. So we can really start to see how these expenses build up year to year and the financial stress and burden that is created on these patients and their families. During this time, the quality of life is also decreasing in these patients. They're experiencing emotional, physical, and social distress. They're facing impaired and reduced mobility, severe pain, and there are changes or restrictions to their usual lifestyle. So they're prevented from working, studying, exercising, and doing daily simple tasks. They're also likely to suffer from social stigma and social isolation, and that can lead to very serious mental health issues. So these issues not only affect the patient, but their families also face this distress as well. Next, chronic wounds may also result in infections, hospitalizations, disabilities, and amputations. Globally, there's an amputation every 30 seconds due to a chronic diabetic ulcer, and it's the reason for 70% of all lower limb amputations. So you can really start to see and understand the significant impact it has. But despite this impact, they have. Hi, my name is Yinyin, and I'm a PhD student with IMPACCT, and my PhD focuses on managing odour in chronic and malignant wounds. So that will be my focus of the talk today. So chronic wounds are those that fail to progress through the normal stages of healing. The most common types being diabetic foot ulcers, venous leg ulcers, pressure and arterial ulcers, and malignant wounds also fall under this category. The most common type of cancers being breast cancer and head and neck cancer. So there's a huge burden caused by chronic wounds in all aspects, financially, physically, emotionally, and socially. In an economic sense, in Australia, there are 450,000 people with chronic wounds, and this costs the health system $3 billion per year, with each patient spending over $4,000 on out-of-pocket expenses. With the aging population and most patients being over 65, that places an unbearable pressure on pensioners and retirees. Similar figures across the world show how common of an issue that these chronic wounds are. In the UK, it affects over 2.2 million people and costing 5.6 billion pounds per year. In America, it's 8.2 million people affected, and that costs them over $23 billion a year. These chronic wounds can take several years to heal, and some even remaining unhealed for decades. So we can really start to see how these expenses build up year to year and the financial stress and burden that is created on these patients and their families. During this time, the quality of life is also decreasing in these patients. They're experiencing emotional, physical, and social distress. They're facing impaired and reduced mobility, severe pain, and there are changes or restrictions to their usual lifestyle. So they're prevented from working, studying, exercising, and doing daily simple tasks. They're also likely to suffer from social stigma and social isolation, and that can lead to very serious mental health issues. So these issues not only affect the patient, but their families also face this distress as well. Next, chronic wounds may also result in infections, hospitalizations, disabilities, and amputations. Globally, there's an amputation every 30 seconds due to a chronic diabetic ulcer, and it's the reason for 70% of all lower limb amputations. So you can really start to see and understand the significant impact it has. But despite these impacts they have on the health system, the economy, the lives of patients and families, chronic wounds remain a really under-recognized and underfunded public health issue. With the metastatic cancers, 5 to 10% of these develop malignant wounds. However, this is an American statistic. There's no prevalent studies on malignant wounds specifically in Australia, and that makes it difficult to determine the extent of the problem here. So there was a report that came out last year by the Australia Medical Association, and they put it in a really good way. So they describe chronic wounds as being a hidden epidemic. So in the study that they did, they actually showed that it's a rising problem. So from the left here from 2015 to 16 to 2019 to 2020, the number of hospital admissions have been growing for diabetic foot ulcers, as well as venous leg ulcers, and arterial leg ulcers also remain steady. So we can see it's a problem that's not going anywhere anytime soon. And it's even expected to raise further due to this rapidly aging population and growing prevalence of chronic conditions like diabetes. Now, I mentioned the focus of today was wounds and odor. So how does smell come into play? Well, we know that hearing, touch, taste, sight, and smell, there are 5 main senses, and they all play an important part in our lives. But smell particularly, it's one of the more powerful senses because it's considered the strongest and quickest memory inducer. Smell information is sent to different parts of the brain, and therefore odors can influence many aspects of our lives. It enriches the experience of the world around you. So different scents can change your mood, transport you back to a different memory, and it may even help you bond with loved ones. But what if the smell is an unpleasant odor? It's widely accepted that in chronic wounds, they have a very distinctive smell, which is often unpleasant, and this is described as malodor. It's a very common symptom arising in people with chronic and malignant wounds, along with these other symptoms, itching, pain, bleeding, and exudate. These unpleasant odors are often associated with necrosis or bacterial infection in the wound, and it is ranked as one of the most distressing symptoms and significantly impacts a patient's quality of life. Malodor can cause a multitude of things: embarrassment, depression, social isolation, nausea and vomiting, loss of appetite, anorexia, and lack of self-esteem. Odors a area or topic that is often avoided or pushed back until it becomes unbearable. And people often tend to shy away from this because of the whole stigma around it, and it becomes a very sensitive topic to talk about. So I say that wound malodor is unpleasant. So to give you an idea of what the odor is like, this is a study that surveyed clinicians in 36 countries, and these were the top descriptive words used to describe odor. So there's foul, pungent, strong, smelly, offensive, fecal, rotten, penetrating, putrid. So we can see how this can definitely affect a patient, their family, their quality of lives, and having this new smell as a part of their day-to-day lives. There have also been a few studies looking at the experiences of people living with wounds. I pulled out some that give an account of malodor. So the first one here being, it's not that it's causing me pain, discomfort. You can live with things like that. It's definitely the consciousness and the smell. The fact that everyone associates it like bad hygiene, that is predominantly, I guess, my biggest thing. So that goes back to how I mentioned that malodor was one of the most distressing symptoms. The second one, another patient said that they didn't want to become my ward mate. They saw my odor wound and smelled the odor, and the wound made me feel so embarrassed. The third one being, I was told about my smell by several people. That was very stressful for me. This odor was really terrible. You might compare it with the smell of a piece of rotting meat. So here you can see the social isolation and the mental health issues, and this whole stigma around the wound odor that these patients experience. So why do we need to focus on malodor in chronic wounds, and why is it the focus of my research for my PhD? Firstly, as I've been saying, it's a very under-recognized area of study. There are very limited studies that specifically touch on this topic and focus on malodor as the primary symptom. Secondly, when assessing odor, it's measured subjectively, and it really varies between clinician to clinician and how sensitive they are to the smell. It's often just assessed as either present or absent, or it's categorized as slight, moderate, or severe odor. Clinical and laboratory assessments are used to identify which microbial species are present, the extent of their colonization, and then to determine the effective antibiotic or treatment to manage the wound. These assessments commonly consist of a deep tissue biopsy, a needle aspiration, or a swab culture. However, all these methods are very time consuming, and some are costly, invasive, and painful. The next thing with managing odor, it's often anecdotal and poorly managed. There's no standardized approach across the field. And some common techniques to use are charcoal, silver, iodine, honey, and essential oils to mask the smell. Clinicians will also often address odor only once it starts becoming unbearable. Controlling odor is usually the key goal of managing a wound rather than early identification or prevention. With this increasing incidence of chronic diseases, the requirement for improved wound care is urgent and critical. And with wound odor being one of the main symptoms, it's really important to shift the focus to early identification and prevention. So with all these, what if I told you there was a way to potentially address these items? With this, I'm going to introduce the concept of an electronic nose. So what this is an electronic sensing device that analyzes gas samples or volatile organic compounds to mimic the human olfactory system, consisting with an array of sensors and a pattern recognition system. This diagram depicts really well on the analogy of how an e-nose comes to play. So we can see on the top row, that's the human olfactory system. So once you smell a sample, the brain will process it and then link it to a memory, or in this case, detect food and whether it's contaminated. Compared to the human olfactory system, the e-nose on the bottom row, it uses a gas sensor array to convert the gas molecular signals into electronic signals. It will then process it and create a specific signature or a smell print, and that recognizes a pattern that can then determine the bacterial species present, say, within that sample or that contaminated food. So over the last decade, the use of electronic nose-based technologies in healthcare, in clinical practice, and biology has steadily increased, especially in things that are researching airway obstructions, respiratory infections, and inflammatory diseases. The most common thing that e-nose technologies have been looked at is in asthma and COPD, as well as sleep apnea. But there have also been studies looking at infections and bacteria in things like lung infections and ear, nose, and throat infections, where they've been able to distinguish the different bacteria that are present in those infections, as well as the different classes of one bacteria. So, for example, like Staph aureus, distinguishing between MRSA and MSSA. So previous studies have found that a change in infection status or bacterial communities will influence the odor that is produced, and different bacteria produce different odors. So using an e-nose in chronic wounds will be beneficial and allow for monitoring wound odor that can help to identify and distinguish these different odors. The use of an e-nose is a very recent and promising method because it allows for a fast and accurate diagnostic aid. It provides an objective assessment, and it's a non-invasive method as no physical contact with the wound is required. And that eliminates both the need for a biopsy of the wound and the need to wait for culture results, which can usually take days or weeks and add to a clinician's workflow. Assessment information provided by the e-notes can also provide critical information required to assist the patient, carer, and clinician in making important treatment decisions. For example, depending on the microorganism present, they can select a certain wound dressing that specifically addresses or tackles that bacteria and smell. So controlling odor is the key goal for management of wounds for all clinicians, and we need to shift that focus to early identification and prevention before it gets to a stage where the smell is unbearable. So what the e-nose will allow is for earlier and more accurate identification of these wound infections, and that will in turn help reduce the time to heal for wounds and reduce further complications and hospitalizations, and also the costs and financial burden of wounds for the patient and the health system. With that being said, the use of an e-nose for chronic wounds is a very new area of research, and that creates many unknowns and questions that do need to be further explored. There have been some studies where e-nose have been used for detecting wound infections or bacteria in the wounds. However, most of these studies didn't obtain samples directly from patients, but rather from bacterial cultures that have been colonized from laboratory or animal models. So what's really needed is research in appropriate environments like hospitals, and application from real world contexts are needed. And this will help to improve accuracy, how it performs, and the application of the real world problems can be identified, any variables that would interfere with the quality and identification of these bacteria. So to implement this e-nose in practice, it's essential to first characterize the odor and determine these patterns that the e-nose would identify, or these biomarkers of interest. So the e-nose would be the long-term goal, but to get started, my PhD project will be the proof of concept study into developing this tool. My project will specifically focus on diabetic foot ulcers, and we will be collecting 2 samples from patients, from chronic diabetic foot ulcer patients at a high-risk foot clinic. I'm collecting at least 30 patients, 20 with a noticeable odor and 10 with no noticeable odor to act as a control.
It's great to hear about this.
One sample will be a tissue sample and the other will be a wound swab. And we'll collect these samples at 2 time points to see that change in odor. So one set of swabs will be used for chemical characterization, and the other one for microbial characterization. So chemical characterization will be performed using gas chromatography mass spectrometry, so GCMS, which is a gold standard for analyzing gases and volatile organic compounds. And we will also use whole genome sequencing of the microbial DNA to determine which species are present and their odor strength as well. So evaluating the compounds emitted from these wounds will determine key biomarkers for scent that can be monitored over time. And that will be key for potential monitoring purposes and development of this e-nose tool and technology. Identifying the presence or absence of certain microbial species can also be linked to identifying the most suitable treatment options to manage the bacteria present. And it allows for the odor strength to be evaluated as well. So this proof of concept study is crucial. It's acting as a foundation and a stepping stone. It's important to first determine what further testing is needed from here, and specific details as how many number of patients we would need to develop this into something bigger, different wound types, variables, and times to implement this e-nose into practice. So these are the references that I've used today, and thank you for listening to my talk.
Yinyin, I just wonder, has there been any experience in terms of this being a self-management tool? Could it be something that patients could use themselves and detect problems at home? Has that been done in the respiratory group at all?
I'm not too familiar with the respiratory group, but I don't believe it's been done before. I think, there's a new area of technology. So I think mainly clinicians have put it to use in clinical trials and not too much of the patient management, the self-management.
Please.
Thanks, Yinyin. It's great to hear about this. I guess my big question is, can you come back and tell us about it when you've done the study? Because it'll be really interesting to find out how it actually works in practice.
Yes, definitely. We've just put the ethics application through that has just got approved. So that's some good news. And I look forward to opening it in the next coming months. So I'll definitely come back and share the results and see how we go with the study.